Hi, good afternoon, everyone. My question is for Minister Duclos. Canada will receive another shipment of Paxlovid in the coming days. But based on the data that we've been looking at, the treatment has not been widely used. So what will your government do to boost the uptake and the use of Paxlovid?
Well, that's a great question, and there are two angles to that. The second angle, I'll turn to Dr. Tam to answer it, because there has been recent, I understand, recent evidence, biomedical evidence of the effectiveness of Paxlovid, which you might be interested to know more about. But on the first part, which is the accessibility, we have indeed sent hundreds of thousands of Paxlovid units over the last months. It started early in the winter, and we'll be there to share whatever provinces and territories required to care for patients. As you might hear from Dr. Tam in a moment, it has an impact not only of reducing the severity of acute COVID-19, but it can also have other benefits. But I'll turn to Dr. Tam for that part.
Thank you for that question. I think there's a number of things that we can do to increase Paxlovid use. It's correct that the federal government has sent, I believe, at least 700,000 doses to the provinces and territories. So I've been discussing with our colleagues and also the clinical care professional groups as to why and how, why Paxlovid isn't being mobilized as much as we think it could be utilized. There's several different factors, I believe. One is awareness for patients that this is an option. So I think we can collectively do more in that area, particularly those with high-risk conditions or seniors. Increasing their knowledge of how to access Paxlovid in their local area, but also the benefit of Paxlovid, which has been demonstrated not only in the clinical trials, but in real life now, that they can significantly reduce hospitalizations and deaths in high-risk groups, particularly in seniors. That group should talk to their physicians ahead of time. Get prepared, because if you get diagnosed with COVID, it may be a bit late to try and figure out where you can get Paxlovid, and you need to take it within a short number of days. So know how to get your rapid test and know ahead of time where you can get your Paxlovid is important. Healthcare providers, I think, have been a bit concerned about using Paxlovid because of the drug-drug interactions. We know that that can occur. But collectively, people can figure out which patients can still use Paxlovid. And I think increased awareness and education amongst health professionals is something that we can assist with. And then there is access, because you have to access a test and then the drug really fast. And you've seen in Ontario just recently that they've announced pharmacists can now prescribe Paxlovid after someone's got a positive rapid test. At the beginning, we didn't have a lot of supply, so people insist that you have to have a positive COVID test, and then in certain groups. And they've widened the eligibility in provinces now so that more people can get it and get it faster. I don't think that's the same method everywhere, but I think sharing best practices on how we mobilize it more, I think will be very helpful, particularly in seniors.
Just to follow up, we've budgeted some $2 billion for COVID treatments, including Paxlovid. Minister, are you concerned that there will be waste?
Dr. Tam, do we have evidence that has been wastage in the use of Paxlovid now?
I don't have specific numbers. All I can say is we have to follow the science on the evolution of the variants as well. Some of the most recent variants, BQ1.1, et cetera, are immune evasive. Those monoclonals don't work. So that will be regular need to not use them, because that would not be helpful to patients. So I think that's totally understood. So we now have antiviral agents like Paxlovid and also remdesivir that has to be given not by orally, so it's much more difficult to give potentially, but there are these options where the viruses have not eluded the drug effectiveness, and these can continue to be used. But we have to monitor susceptibility of the virus to these medications. And I do think that we mustn't let our scientific knowledge and biomanufacturing of these drugs go to waste, because we need to now adapt them to future use as well. But while I don't have the numbers, I think there's necessarily a need to park those drugs for now if they don't work.